I actually started Beyond Blue, but the seed that created it, the thought, came from my daughter, who in 1997 came to me one day after two young men that she knew died in totally unrelated car accidents in the Western District of Victoria. And she was, as you can imagine, very upset. And she said to me, "Dad, what can you do to stop these young men dying on the roads?" So I thought I was facing a how do I reduce the road toll issue. But as we learnt more about these two deaths, we understood that both young men had actually used their vehicles to take their own lives. They were suicides. So that changed our emphasis away from reducing the road toll to learning more about depressive illnesses, mental illnesses, etc. And by this stage I'd realised that mental health, depression, anxiety, stress were not issues that had a priority, not only among the health portfolios around the country, but didn't have a priority with the public. So I realised it needed to be treated publicly, and it needed to be treated federally. Since then, Beyond Blue has established its priorities, which deal with destigmatising the illness, conducting research. We don't do it ourselves, but we commission research. Secondly, from that research, being able to develop educational materials like these books, these videos. Important to get the message out. Our website is perhaps the best medically related website in Australia. Fourthly, we deal with the professionals, those who are doctors, psychiatrists, psychologists, clinical nurses, etc., and they need a lot of help, I must say. They're in a very hard, tough space. And lastly, we deal with the carers. John Howard, 2 years ago, put mental health on the COAG agenda for the first time ever. He contributed an extra $1.9 billion of federal money to mental health, a huge contribution. Kevin Rudd, in his election campaigning, reinforced just in this recent budget, has allocated $85 million to enable a piece of research that Beyond Blue has done into postnatal depression to be implemented so that over time every pregnant woman in Australia is going to be able to be screened while pregnant for depression. Every government in Australia, regardless of its politics, and every territory government is now a financial supporter of Beyond Blue. And on top of that, we get a lot of donations from individuals. We're now, because our brand is well recognised and I think respected, we're getting extraordinary support from the community. So it's a very important organisation. It has, in its short period of time, 8 years, been able to establish a changing attitude to mental illness. It has established a public priority, and it has established, importantly, a political priority. Change, it's an extraordinary thing, but human beings are not well prepared for change. And often that lack of preparedness, again, leads to a lot of illness. How you deal with change in our life is very important about your personal well-being. And it's not something necessarily that you can just assume that people are going to react well to. And it's not something that is taught. It's not even something I think that most parents think about when raising their children. But this issue of change, to me, with information coming to us faster than ever before, is one of the most important elements to come to understand, to be able to deal with, and to move on. Enjoy what's happened, learn from what's happened, but don't try and want to return to where you were. You've got to be able to move on in life, because if you get stuck in the past, often that disappointment will spiral down into anxiety, stress, and a depressive illness. So change, dealing with it, terribly important. Depression is just another illness, firstly. Secondly, it's not a crime to be ill. And thirdly, the quicker you take that first step, if you understand yourself that you're challenged with an illness, the moment you admit that, that's the first step to recovery. And we would urge all people with an illness to go and seek professional help. For some, still, there is this stigma associated with the illness, and it's the stigma we're trying to remove. It's our first priority, our first goal. But some people think if they admit they've got an illness, depression, because for so long the community have said, oh, well, you know, get off your backside or go and take a Bex and lie down, has been our uneducated response to someone's dropping of performance or isolation or changes in eating habits. So there is still the stigma around in many places. But it's not weak to seek help. In fact, it's the most responsible thing to do. As I said, our objective is to get to the stage where depressive illnesses are no different from the common flu. You've got an illness? Oh, bad luck, let me help. Can I help you to a doctor? Get it fixed, get on with your life. The gift of life is the most important gift we have. We've got to respect the gift. We've got to make sure we take on responsibility for our own welfare and our health. And where and when from time to time things happen beyond our control, then we've got to seek help. And that's why we have our professionals. You can either go and look at our website, Beyond Blue, www.beyondblue.org.au, and that'll not only tell you the ingredients that might cause depressive illness, it'll give you information. If you're actually wanting to find a doctor who's trained in this area, we have a list of professionals there. So that's of help. But then secondly, I do advise you, go and see your doctor.
Hi, I'm Jessica Rowe. I know what it's like to have mental illness impact on your family. My mum has bipolar disorder, so from probably about the age of 10 or 11, I was looking after my mum and my two younger sisters, and I know how difficult that can be. Funnily enough, I also had an experience with depression soon after I had my little girl Allegra. I had postnatal depression, and what was quite ironic for me was, despite knowing what I did about mental illness, I still felt the stigma and the shame of experiencing depression. Probably first realised that mum wasn't like sort of other mums when I was about 8 or 9, I think, and I used to hear mum crying herself to sleep each night. And my bedroom was right next door to mum's, so I'd hear her sobbing herself to sleep. And it was really difficult as a little girl to hear those sounds coming from your mum's room. Because in the daytime, she seemed like a normal mum. She sort of seemed to be coping, but at night it was when everything seemed to fall apart for her. And I remember at the time feeling so scared and vulnerable because I didn't know what to do. We were lucky because we had the support of my dad and my stepmum, so we were able to stay with them when mum was sick, which was such a godsend because I do know for a lot of other families, they don't have that immediate support. And then that's even scarier if you think, where on earth am I going to go and stay? Where will I live? So we were lucky we could do that. Mum was always very open about her illness. When I was much younger, I didn't understand what it meant, mum's illness, but as we got older, I understood more, and I think in a way that probably wasn't such a great thing because I knew the tricky road ahead that mum was facing because, you know, bipolar is an episodic illness, so there were plenty of times when mum was well, but when she had an episode, she would just go down very quickly. I remember her telling me that she'd been diagnosed with bipolar because leading up to that she'd had her breakdown and a few other sort of episodes, but not really knowing what was going on. And I remember her explaining the relief that she felt to finally be diagnosed because she felt that she could then put a name to her condition and she could explain why she was feeling this way. It wasn't simply she was nuts and totally losing her mind and had no reason to. There was an illness that was diagnosed, but it also meant, I think more importantly for mum, there was a treatment and that there was a way of managing her illness and there was a way of living with it. I've been very lucky with the sorts of opportunities I've had in my life, and I've found as a journalist and a news presenter that there were times when people would ask me to talk about particular issues, and an issue that obviously is very close to my heart is mental illness. And mum and I thought, well, if we can share our story with people and if it offers some sense of hope, then it's worth doing. And early on when I spoke, it was a very small gathering of people who were it was carers actually, people who were looking after loved ones with a mental illness. It was funny, I was very anxious doing it because I felt, oh my God, how much of myself am I exposing? What am I opening myself up to? But it was incredible, the response that I got, and almost the reassurance that I wasn't the only one, but I think also for these other people to go, well, we're not the only ones either, and that they could look at someone like me and say, well, she's lived through it with her mum, and she's managed to go on to lead a happy, successful life for all intents and purposes, and there is a way through it. There is a way to navigate through it. And because of that response that I got to begin with, I thought, oh, I've got to keep doing this. I sort of almost felt it was my responsibility. Funnily enough, I felt ashamed when I started to develop postnatal depression with my little girl. When Allegra was about 6 or 7 weeks old, I started to realise how I was feeling was more than just being a new mum. It was more than just sleep deprivation, and it was quite... it was difficult for me to come to terms with what I was going through. I was feeling incredibly anxious, but not just normal sort of nerves or anxiety. Because I think the thing is, when you're a new mum, it's like, oh my God, what am I doing? Nothing possibly prepares you for what this tiny little person is going to do to your life. But I was really anxious to almost a point of obsession with, oh my God, is she going to be all right? But if I leave her, might something happen? And it was really getting out of control in my head, the anxious thoughts. You know, it was beyond, oh, is she getting enough sleep? It was really out of control. So my anxiety was way over the top. I felt very out of control, panicked, and also I felt empty, and I felt like I was losing my mind, despite the knowledge that I had of treatment, the support that was available, and the message that I've been saying to people for so long, don't be ashamed, put your hand up, it's okay to ask for help. I found myself struggling with all of those things myself, and that was an enormous challenge for me, because I thought, God, if I feel like this, how must a lot of other new mums feel who don't have the information, who don't have the support? I remember just thinking, oh, how am I going to tell my husband about this? And I remember late one night sort of saying to him, you know, I'm not doing well. And he said, what do you mean? You look, you know, you seem like you're coping well, you're looking after our daughter beautifully. It seems to be okay. What do you mean? I said, no, I'm really afraid that I have postnatal depression. I need help and I'm not coping. And I remember he took me in his arms and he said, it's going to be all right. And that gave me so much, makes me emotional thinking about it. That gave me so much relief, because I knew that it would be okay. And I think, but just that initial asking for help can be so hard. But you have to. And I think almost that conversation I had with Peter was the start of me getting better. So I saw a psychiatrist and saw her, I still see her, but in those early days I was seeing her every week. I was on antidepressants, which worked very well for me. My advice to new mums out there who are feeling like they're not coping is get help. Put your hand up. I know how difficult that can be, because that was a real big step for me, to put my hand up and say, I'm not coping. But it's so important to do that. And it's okay to put your hand up and say, I'm not coping. Doesn't mean that you're a bad mum. It doesn't mean that you don't love your baby. It just means you need some help, rather than feeling like, oh my God, I have to just keep going through this on my own. You don't. There's help out there and you can feel better.
My first experience of anxiety I remember very well. I actually probably had one a little bit earlier, but the one I really remember was where I'd gone to a friend's place after rehearsals. We'd just signed up for a year's contract of doing play every month. So it was a great contract, and I'd been rehearsing and gone off to a friend's place, and they rolled a joint with hashish, which I smoked a bit of marijuana, but I didn't smoke hashish much. And I had this joint and didn't know what had hit me. Just was so frightened and absolutely terrified. So I attempted to drive home, and then I got into bed. I felt so shocking. So I didn't touch marijuana or anything like that again for a long time, for 20 years. And 20 years later, I thought, it can't hurt. I'll have one puff. And I immediately had another huge anxiety attack. But I'd had anxiety, from once that started, then I started having anxiety attacks. And you get this incredible feeling in your stomach. You become quite frightened, and you can't put two words together. Because your ability to be articulate goes, and it's just horrifying. It's an awful feeling, absolutely awful. But there are other, people have other sort of symptoms too. People have heart palpitations, but it's extremely. It's like your life is in danger. Like your life is threatened. That's an anxiety attack, a panic attack. But leading up to that, you'll have anxiety. You'll just have, and it's recognising those early symptoms that stop you going into the panic attack. I didn't get depressed till about 20-something years into having anxiety disorder, which I didn't really know I had. But that, for me, I tipped over into major depression. Everything went wrong with the TV show I was doing. Everything was going wrong, just disaster after disaster. I went out with the channel executive and the executive producer and got blind drunk, which didn't help. That does not help. I obviously was diagnosed as having major depression. And they said with phobic anxiety, I think they said. And that didn't mean anything to me. So the depression was dealt with. I was put on antidepressants and things like that. And because the anxiety came straight back. I still didn't realise I had this thing called an anxiety disorder. And I really didn't realise it until Bronwyn Fox sent me a copy of her then book about anxiety and asked me to be a patron of the Anxiety Disorders Foundation in South Australia. And that was a real revelation. When I read the book, I realised what was wrong with me. So that was a start of the sort of healing process. I went and had cognitive behavioural therapy. And that was a real revelation, Cognitive behavioural therapy is a very practical therapy. It's not... There's a little bit of talking, not much. There's a little bit of talking just so they can find out what you tell yourself, why you're having, anxiety and why you're having panic attacks. And then once they're onto that, then they just give you exercises. And the part of it that I really, held on to, it was the challenging your thinking, making sure you label the thought that when you start to feel a bit uncomfortable, what are you telling yourself? Don't run away from it. What am I saying to myself here? What am I telling myself? I'm saying I am going to make a fool of myself. I'm going to put my foot in it here. Everyone's looking at me. And then when you get the thought just right, and you'll know because you get the feeling as soon as you get once you label it correctly, and you write it down, because this really concentrates you. Don't try and do it in your head, but if you write it down really, and then you look at it, and then you challenge the thought and say, well, what's the proof of this? What's the proof that I'm going to make a fool of myself? What's the proof that everyone's looking at me, or whatever? And you write down. Other instances where you've done a show like this or whatever, and you've been all right. And then your stress reduces, your anxiety comes down. And eventually this becomes your new way of thinking. You learn to not go to those areas. And if you do go to those areas, you learn to challenge it. Like you've got to get it early. When I talk to people about anxiety, I say to them, you will not believe how you feel after you've done the CBT. You will not believe it. that you've got your life back, and it's like, oh my God, I forgot how good it was. And it just requires a little bit of effort at the beginning, and that's a bit frightening. But it's as long as you realise that you're not going to be devoured by a lion or anything like that. I mean, you might feel really uncomfortable, but it's just your way of thinking that's wrong at this time. And once that sort of veil has been lifted, you won't believe it. It's phenomenal. So I meditate every day. I meditate twice a day. It's absolutely, it's a wonderful experience meditating. But also, you can then check that everything's okay. And if you're holding on to something, you can then deal with it. Not try and push it away, but deal with it. I do that twice a day. That really keeps the stress levels down. And I also, not always, but I walk, which is great for people with depression. Get up in the morning, make yourself get out of bed, put on some walkers and go for a half-hour brisk walk. And that really lifts your spirits quite quickly. I mean, if you think you've got symptoms of anxiety, you should go to a GP, and the GP will have a checklist, and then the GP can send you to a psychologist. When I was diagnosed with depression, it was a relief. At least I knew what the hell it was, and then you can do something about it. And it was the same with the anxiety. I mean, I've had more problems accepting that I'm hard of hearing and have to wear hearing devices, so I don't even call them hearing aids. I find that harder to deal with. I'm kind of better about it now. I must admit, I'm not embarrassed about saying it. In the end, you realise that's not where your manhood is, You can sort of say that you get anxious, you get a bit frightened, something goes a bit awry. And it's, some women find it very attractive. So there's a little lesson there for you guys.
Hi, I'm Craig Hamilton. I'm a sports broadcaster with ABC Radio, and in the year 2000 I was diagnosed with bipolar 1 disorder. Well, the most severe depression happened in 2000, the year 2000. I just started to shut down for no apparent reason. At the time I became withdrawn, I went off my food, my appetite decreased. I stopped socialising, I stopped picking the phone up. I found I had trouble at work, I couldn't concentrate, I lost weight, sex drive lowered significantly, just general zest for life. All of that, I had all those symptoms. I had my suspicions that it was depression, but I thought I would be the last person ever who could experience depression. I just didn't think it could happen. I can remember at the time thinking, when I went to the doctor, give me something other than depression. I mean, make it something exotic to explain why I feel like I do. Like a brain tumour would be good, or chronic heart disease would be okay, even a well-developed cancer. Those illnesses are more socially acceptable, and they are still, to a degree, more socially acceptable. You tell someone you have heart disease, you tell someone you have cancer, you tell someone you have a tumour, they go, oh, you've got every right to feel lousy. You tell someone you have depression, certainly 8 years ago, there was what's that? Get over it. The doctor suggested that I take antidepressant medication straight away. 3 days after I started taking it, I felt worse. 6 days after it, I started taking it, I felt worse again. And 9 days after the commencement of the medication regime, I was suicidal. So that was the scariest time of my life. I thought this wonder medication had failed, and there was no hope, that I was sliding on a downhill slope that there was no coming out of. Day 10, I felt slightly better, just marginally. And I thought, maybe we've got some hope here.
Hello, great to have you with us today. ABC Local Radio, Craig Hamilton with you.
After day 10, things started to improve, and by the 4-week period on the medication, I was feeling fine. I was feeling absolutely okay. I was back to my normal self. I had all my energy back, and I thought that's the end of that nasty chapter in my life. That's the end of the depression. Let's get on with life. But round the corner, lurking, was this thing called bipolar disorder, which I didn't know I had at the time. And bipolar disorder, there's two distinct phases of that illness. One is a hugely depressed state, which I just experienced, and the other is a manic state, which is a big high. Now that was just about to happen, and that probably within the next 4 weeks, my mood just continued to escalate and rise. Elevated mood, the signs of elevated mood are, again, lack of sleep, but you don't need sleep. You have huge amounts of energy. You have a stack of ideas. You have, you're able to multitask. It's a high beyond all highs. Everyone around me at the time could pass off this behaviour as, well, why wouldn't he be excited? He's going to the Olympic Games as a broadcaster. I mean, this is a dream come true for a sports fanatic. I began behaving in a very bizarre fashion on the railway station in Newcastle at Broadmeadow on the way, before I caught the train to Sydney. I started screaming, I started yelling, I started abusing people around me. And so therefore I was out of control. I was psychotic at that time, and the police were called. I was taken forcibly to hospital in the back of a police paddy wagon, and within the first 20 minutes of being there, the word bipolar disorder was used. The words bipolar disorder were used for the first time, because as soon as they put the history, my history, over the past 12 months together, this acute clinical depression, treatment with antidepressant medication, and then a big high ending in a psychotic episode on a train station, it's bipolar disorder. Massive low, massive high. Anyone with an illness like bipolar disorder has to look at the big picture, and take a holistic view to staying well, and not simply rely totally on medication. Medication is a part of the jigsaw puzzle. It certainly is for me, and it's an important part of the jigsaw puzzle, but it's not the only piece. I make sure I get plenty of sleep. That's critically important. Monitoring your own stress levels and being honest about how you are feeling. Exercise, also important, to have a regular exercise regime. Physical fitness, your body feels good, it helps your mind feel good. Relaxation techniques, I do things today like yoga, I do meditation, and these are all things that I would never have dreamed of doing before the events of 2000. Alcohol has been clearly a drug of choice for me through my late teenage years, through my 20s and through my 30s. And I can now identify the drinking, the binge drinking, as a way of self-medicating this illness. I can look back now, with the benefit of 20/20 vision, and look at the previous 10 years and the previous 15 years and the previous 20 years, and know that these mood swings, these severe mood swings, were there. And when I was high, I'd want to drink and party all night, and could. But these days, very moderate. A very moderate social drink. I still have a drink. I'm not totally teetotaler, but it's moderate. And I don't miss those days. I don't miss the hangovers. I don't miss the headaches. And I feel better for it.
You're listening to ABC Local Radio this morning. Craig Hamilton with you.
The stigma around the issue of depression prevented me from getting the help that I needed for 6 months or more. And we've all got to get over it. It's held us back as a community for too long. And I know that in 15 years' time, maybe 10 years' time, we'll all look back as a community and we'll say, boy, we were slow on that. We needed to get out of the blocks and be far more proactive in reducing stigma. It's happening at the moment, but it needs to continue to happen.
I think my biggest worry was just being a failure. I was playing AFL footy and probably seen as, being a strong and happy guy, yet, underneath I wasn't. I was, the exact opposite, and I didn't want people to know that I was struggling, and I thought it was a weakness in me, and I definitely didn't want anyone to think that I had some sort of soft underbelly or there was something wrong with me, because I really felt that I was deep down. I felt that I was sick, and I knew that I had a problem, but I just didn't want to admit it. I was fine when I had things to do, if I was out training and could keep my mind busy. But when I was in probably quieter periods and my own time is when I really struggled with the depression. I really just hated looking at myself in the mirror, and I really didn't want to come to training. I didn't really enjoy being around people. I didn't sleep, basically, for days on ends, just where my mind would be running at 1,000,000 miles an hour about all sorts of crazy things. Unfortunately, I wasn't able to stop it. I was getting to the stage where I was getting a bit, I suppose you could say, a little bit suicidal. I couldn't go on playing senior football. I was struggling to get out on the training track. I was continually vomiting, and basically I think mentally I was shutting down, and physically I couldn't keep up with the demands of AFL footy. It felt like I was having a nervous breakdown, basically, and I'd be crying before training sessions, crying before games in the corner, just trying to hide it from my teammates, but I was just so drained of energy. I couldn't give 100%, and that was making me feel even worse. I'd pushed myself to my absolute limit mentally and physically just to stay in the business for that long, because I'd been doing it for about probably 7 or 8 years, and dealing with the depression on the side, and it had just got the better of me. As a final effort at saving sort of myself and probably my football career and getting back on track, we decided to go and see a psychiatrist and just see if there was anything wrong or something they could help, maybe some medication. I went and spoke to him about my problems I'd been dealing with, and he diagnosed me just with serious depression. With the medication I'm on, I started on one type, which didn't work for me, so then I tried another, and since I've been on that second type, I basically don't know that I'm on it.
Thompson now, can he swing onto the left?
I've changed probably my approach towards footy. I base all my football now around how hard I work on the ground and basically things that I can control. Every week you're going to be playing on a great opponent, so you're not going to play well every week, but as long as I go out there thinking that I'm working hard and that I'm giving my all, then that's all that I care about, and I can control that every week. So basically every week I succeed, whether I play a great game as far as kicks and marks go or not. So it's been such a small thing, but it's taken a hell of a lot of pressure off of me to perform, and what I've found is my performances have gone up anyway.
Thompson for his third. He's on fire. Oh, he's got it! He's got it again! Got it. Thompson, 1 out. this to equal his career best. 7 goals for the former Hawk.
When I have a problem or when I get a bad article written about me now, I face up to it. Like with bad articles, I put them on the mirror at home, and so that I'm looking at it every day and basically saying, you know what, that doesn't affect me. It's the same thing with playing the game. You've got to confront it. So my whole philosophy now is around is just the quicker I face up to it, the same as speaking to the public about my problem with depression, the quicker you can get it off your chest and get on with life. One thing I basically say to people, whoever I talk to, whatever ages, if you think you've got even the smallest of problem, put your hand up and ask for some help and find out if there is something wrong. You'll never know until you put up your hand and ask for that help. And as far as, you know, people talking about, you know, I don't want to go on a medication, for me it's just absolutely crazy talk to not want to get yourself help for an illness that you're suffering. I mean, if you had a headache, you'd take a Panadol. If, you know, if you've got a runny nose, you take a Sudafed. But if you've got depression or you're really struggling, you don't want to take medication just because there's a stigma attached to it. It's just rubbish. I mean, I'm still on medication, take medication every single day, and you know, I try to say to people, you know, you do what you have to do to get well, and if that means taking medication, well, you know, you're silly not to put your hand up and ask for that help.
Το όνομά μου είναι Βασιλική Κατσίφη, η μάνα μου έχει σκιτσοφρένεια και εγώ έχω διπολική πάθηση. Είμαστε Έλληνες. With the Greek community, mental illness is sometimes seen as evil spirits, and we bring the priest in to do a spiritual healing on the person, and it's not seen as a medical problem. So it was very shameful, and my father was just very scared that we would not be seen as normal. We would just be seen as abnormal and weird and not be accepted in the Greek community. My father was a very proud man, and he suffered a lot of stigma and shame because of my mother's illness. He was frightened of her behaviour, and he didn't want us bringing any friends home. I didn't get the bonding with my mother. I had nobody to talk to about female issues, about how to do housework, what to do about boys. She was always in her own world. At the time, the only outlet my dad had was the GP. There was no other information as to what the behaviour was, what brought on the behaviour, the fact that it was stress indicators, the fact that she needed her sleep. Coping mechanisms were not brought into account. It was just medication, and don't talk about this to anybody else. They won't understand. And my father would just tell me, you need to study. You're going to be a doctor or a lawyer someday. That's all you need to do. So I didn't have those Greek skills that I really wanted, and that I would be accepted in the Greek community. I just felt, in a way, just there was something missing always in my life, and it was just that burden of having the shame. And I never thought in my life that I would then develop a mental illness, and then the shame would come on as an internal shame onto me, and that's what happened. When I was 18, though, I started exhibiting signs of depression, and my father just couldn't believe it. He was very, very shocked. My brother was the only one who was saying, you need to see a counsellor, you need to see somebody. And my father would quickly say, no, she's fine. I dropped out of university, I stopped socialising, and my father would just look at me with great sadness and great shock and wonder what was going on. But because of his sense of stigma and shame, I got no help. The way depression begins with me is always withdrawing from family and friends and not answering the phone. And then I become lethargic. But the most significant change that happens that really hurts me as well is I actually think I'm different to everybody else in society. I walk down the street when I'm depressed and I look at other people and I think that everybody is better than me. Everybody's on a better life path, a better journey. And I'm somebody that's really low and somebody that shouldn't be alive. It was not until after my father died that I went into a much deeper depression because of his death that help the help that I needed came to me through my uncles, who actually got me to a GP and got me to a psychologist. Bipolar wasn't diagnosed until after 7 months of being in hospital. I was let out for Christmas, and within 8 weeks I started being very elevated in mood, and because my friends were inviting me to go out to nightclubs, I was staying out really late, and all of the traditional classic symptoms of bipolar 1 appeared, where I started having religious thoughts. I started thinking I was the Virgin Mary, I wanted to save the world. So that's when the journey of understanding the illness started, when I was properly diagnosed. It was a relief to know that it wasn't me, it wasn't a weakness in me. It was actually something physical, something in my brain, and something that I wasn't to blame. I had no control over it. It's just a fact of life. And once I take my medication and I see my psychologist and my psychiatrist regularly, then everything is fine. Then I can maintain my wellness. I also had cognitive behavioural therapy. It's in the sense of being able to manage those negative thoughts. So, for example, if I was at uni today and I was struggling with an essay, instead of saying, I should drop out, this is the end of the world, I don't generalise or catastrophise anymore. I say to myself, I problem solve. What can I do to help myself? And this is not the end of the world. This is just a small blip on the horizon. Let me do something about it. So I've changed cognitively the way I view things. I have a stay well plan at the moment where I have 3 friends who know my plan. So they're aware and they can pick up the signs and symptoms and tell me, have you slept? If it's a manic symptom or with depression, do you need some more support? Do you want to go for a coffee? Are you okay? Do you want us to visit you? Things like that. It's extremely important for organisations like Beyond Blue and Multicultural Mental Health Australia to partner together to form publications such as the multilingual fact sheets that they have formed in 20 languages, and also the Beyond Blue fact sheets on depression in different languages, because there's so much stigma and shame out there in non-English speaking background communities. There needs to be a lot more education about what mental illness is, that it's treatable, it's manageable. Once a person has a diagnosis, they can see their GP as well. The GPs are now trained in mental health issues. It's not something to be afraid of and to be in the situation where my family was, where it was swept under the carpet. Αν θέλετε να μάθετε για την κατάθλιψη ή το άγχος, να τηλεφωνήσετε το Beyond Blue ή το Multicultural Mental Health Australia ή να πάτε στην ιστοσελίδα.
My name's Lynn Chaplin and I'm the current chairperson of Blue Voices, which is a reference group for Beyond Blue made up of people with personal experience of depression, anxiety, bipolar, postnatal depression, some other related conditions, as well as people who are the primary supports for these people or carers of people with one or more of these conditions. My daughter got pregnant and she had depression beforehand, but it brought up a whole lot of stuff for her, and she became very unwell with her depression during the pregnancy, and she had morning sickness all the way through, and also she didn't live with her father, so she didn't have any additional support apart from myself and her sister and her dad, who is no longer on the scene, so no longer my partner. So, it was a hard time. Unfortunately, we had a major event happen on the day that her baby was born, and her closest friend died, and that was really hard. The baby, Sam, was in the special needs nursery for I don't know how many weeks, until he was full term, I guess. So that was a hard period too, and it's sort of everyone was a bit concerned about the bonding experience between my daughter and her bub. I could really see that she was starting to deteriorate, and quite significantly. She was really struggling eventually and wasn't coping, and started to think that she was not a good mum and that she was blaming herself. She was crying at the drop of a hat, just doubting herself so much, and starting to have really. She started to tell us that she had some really bad thoughts, and we were pretty worried. Yeah. We could see that she really needed some extra help, and took a lot to get her to go to the GP. She just simply was so unwell by this stage that she just, it was really hard. Eventually, she became so unwell that she had to be admitted for 6 weeks into a mother-baby unit, and that was a pretty harrowing time for all. My ongoing role has been to support her, look after the bub whenever I can, to give her a break, encourage her to get to appointments, just simply to be there to help out, but also to know when do I step back and give her a little push to say you can do this, and yet really she's a single mum, she has to do it. So that's hard for me, knowing that I can't fix it. That's really hard for me as a mum. I asked if I could attend an appointment with a psychiatrist with her, and I found that, or we both found that to be very beneficial. I was able to ask questions that perhaps she was too withdrawn to even think of asking. I asked about medication issues, and I didn't want to know anything about the personal stuff. It wasn't my role. I wanted to know how I could best support her, and it's hard work emotionally for sure. I'm tired, I lose sleep, I want to do more, but I've got to know when to step back to, and I've got to know when to look after myself. Gosh, I'm tired. It's really hard stuff. It's constant. It's exhausting. It's emotional. It's like walking on eggshells, I guess. It's really important for people that are looking after somebody with depression or whatever to make sure they look after themselves too. And sometimes that's hard because you get really busy and you get caught up with the caring role. But just thank God for my work. I work 4 days a week, and my work colleagues are wonderful, and that would be my primary, my most way I look after myself. My best support comes from there. I've experienced depression myself, so I know the feelings and some of the lack of, if you stop sleeping and have those sort of things coming up again, you know that you have to take a step back and think, I've got to look after myself so that I can continue to support her. I know that probably the things that I'm saying, I think a lot of other people might relate to, because there's a lot of people out there looking after or supporting or caring for somebody with a mental health problem. And I think I really believe that it's really important to make sure you have good information to help you support the person that you're looking after. There's great information out there. The Beyond Blue website's got great stuff on it, how to support somebody with depression and anxiety, etc. A lot of people that are in a caring role are very vulnerable to getting depression themselves because it's very demanding. If a carer is sort of struggling, there are some supports out there, and you need to really look at where you can go to get help. But certainly there's you can contact the Beyond Blue info line and have a chat there about referral options for themselves. You could consider one-to-one counselling with perhaps a psychologist to sort of talk about the hard yards that you're doing.
I'm John Conrads. I have bipolar 2 disorder, but it's been well managed and life's good. Well, bipolar is a name for the old manic depressive, and everybody has their ups and downs, and everybody can be the life of the party or be feeling down. When it happens regularly for no reason, as that's when the danger signs are on. It was mainly depression. The highs were only achieved under a couple of noggins of alcohol, and they were nothing more than, oh yeah, I guess so, a bit more than the life of the party, sometimes a little bit outrageous, flirtatious, embarrassing my wife and my friends. My feelings are that, life was normal. I felt good, I expressed myself. I felt lousy, I hid from the crowd, and I got myself in a little corner and hid there, or avoided contact. Feeling low is tough. You can't see the sky blue, even though it's blue. You can only see you can't even see the glass half empty. You can only see the glass empty, and it's really an awful feeling, because in my case, I was 59 years old when I was first struck this big depression. And I thought I'd thrown my life away. I was supposed to be some sort of millionaire somewhere by now, retired, etc., playing golf or semi-retired anyway. And all I could see is a bleak and black future. It's a horrible feeling. Anxiety comes along with that. Anxiety is like butterflies in your stomach, except the butterflies have got razors on their wingtips. I tried to hide my feelings, and I can trace them back as a regular springtime blues. But in those days, I was already a senior executive, and I had a private secretary and an office that I could close. And I'd stare at a piece of paper for an hour or so, doing nothing, and then all of a sudden pretend that I had an important meeting that was just being called to go to. So I tell my secretary I'm going to be away for a couple of hours and drive around aimlessly. So, in fact, in positions of importance, people can often camouflage their feelings better than if they're exposed to everyday life. And I was one of those who practiced that camouflage. And it took Professor Gordon Parker at a board meeting of the Black Dog Institute, of which I'm a director, to see, in his terms, see the light go out of my eyes and say, "John, you better come up and see me." Well, my wife was very worried about me, because I've always been the leader of the family, the breadwinner, the successful executive. My friends who knew about my depression were worried about me. They saw me, just not being able to enjoy myself in their company, which I used to do. I think the key thing is, it's not my fault. It's nothing to do with the way I've acted or done or whatever. It's chemistry in the brain that used to function properly and now doesn't function properly for whatever reason it is. And when I realised that it wasn't my fault, you mean it's not my fault? It was just an amazing, amazing relief of guilt, because we feel, and I felt guilty about the way I felt. It was up to me to fix it up. I've fixed up everything else for the last 50 odd years, or 40 years. Anyway, it's up to me to fix things up. And this one you can't fix up yourself. And being, trying to tough it out is not only cruel to yourself, but to people around you. Often it's very hard for carers and people around depressive people to have the right choice of words. And often it can be exactly the wrong choice of words, along the lines of, you're not the man I married, and stuff like that. My wife's been pretty good, but there are times when even she admits, I can't understand this stuff. And you got to expect that. My Stay Well plan is, first of all, medication, and it doesn't bother me. And then I think physical fitness is so important. Now, that's a real challenge, because when you're feeling depressed, the last thing you want to do is get out of bed or exercise. That's where mates come in. And if once they know that you've got the problem, get them on side. They'll come up and give you some support, even if it's not 7 o'clock in the morning, it can be 9 o'clock in the morning. That's better than staying in bed all day. So I think just general well-being, eat well, and keep fit are very, very important. My advice is to see your GP. GPs are much wiser about mental disorders these days. Websites are available now with self-tests where you don't have to actually talk to anyone. You can actually find out yourself, do a self-test, and then get yourself to the doctor.
Well, mental health problems, as all of us know, are extremely common in the community. I mean, these are the sorts of issues that you really know about either from your network of friends or family, and they cause a lot of disability and distress in the community. Some of our surveys suggest that, you know, in 1 year, about 5% of people get what we call a depressive disorder, about 7% get an anxiety disorder, and about another 7% get a substance abuse problem, so problems like drinking alcohol or using drugs. So these are incredibly common problems. GPs have a really important role as part of our mental health system. Firstly, they often know you quite well, and often they know the families or the local culture, and that can be really helpful. The other thing is GPs are really well placed to look at the mental health side of things and at the same time look at the physical side of things. And often mental health problems are very linked in with physical problems, and I'll give you an example. So it wouldn't be uncommon in general practice for a patient to come in initially worried about, let's say, chest pains or palpitations, who actually their main problem was anxiety. So in that setting, the GP's got a great opportunity to look at the case, make sure they're not having a heart attack or not having some major physical disease that we ought to check. And at the same time, you know, when results come back normal, to have a chat with the patient about, well, what else could be causing these symptoms? So in medical terms, we often call that somatisation, and it's very common in general practice. The other reason why GPs are very helpful in this situation is some physical diseases can cause mental health problems. So I'll give you an example. A classic is a disease called thyrotoxicosis. So your thyroid gland's in your neck, and sometimes it makes too much hormone. And over the last 10 years of clinical practice, I've had 2 patients who everyone thought their main problem was anxiety, but no one had actually checked their thyroid. So the GP's in a really good place to say, maybe there's something physical causing this. The other possibility is medications. Now, medications for all sorts of other problems can sometimes have the side effect of upsetting people's mental health. And that's another thing that your GP can actually look at, which is very helpful. In terms of what people can expect when they go to GPs, I'd like to suggest a few tips.
I don't know, I just haven't been feeling right lately.
The first is pick the right GP. And I guess in an ideal world, we would hope that every doctor is absolutely fantastic at managing mental health problems. But if you speak to people who've been through these problems, common sense will tell you there's going to be a variety of interest and skills in mental health problems. Now, your usual GP might be terrific, but otherwise, maybe chat to friends or family, and usually the grapevine's pretty good. People know which doctors are going to be pretty helpful. The second thing I'd like to say is GPs are very busy. You know, managing mental health problems is just one of the things we're doing. We're managing diabetes and arranging immunisations and all sorts of other preventive care. So it's smart, in my opinion, to book a double appointment with the GP and try to pick a time when they're not going to be absolutely flat out. So I can tell you, Monday mornings and often, you know, late on Friday are pretty busy times for most doctors. So if it's possible to book an appointment outside that time, that's a good idea. Another tip for seeing the GP about a mental health problem is to be upfront about the problem. A lot of people will come to the doctor, and I'll give you a brief anecdote here. Typical patient will come in, maybe a guy, And he'll come in and he'll say, I'm just here for a checkup. And you're chatting away, trying to work out, your blood pressure's fine, everything's good. And just as he's leaving, he'll turn the door, he's got his hand on the door handle and he'll go, also, I'm not sleeping too good. Do you think there's a problem there? And we call that, the door handle consultation. Now, of course, you've got a full waiting room, and so the GP's more likely to be a bit cursory or dismissive of that in the real world. And in fact, there's research to show if you present your mental health problems late in the consultation, the GP's a lot less likely to actually do anything about it than if you're upfront about it. Another tip for going to the GP is to write down what some of the problems have been. So often people come to the GP and they sort of freeze, or they're rushed, or they make light of the problem. A classic example would be some of the mums who are having postnatal depression problems. So they can present to the doctor in a 5 or 10 minute consultation looking fantastic. Makeup's on, everything's looking good, and ask them how they're going, fine. So sometimes if before you come to the GP you write down some notes about what's been going on, you might say, look, I haven't been sleeping, or I've been having arguments, or whatever the issues are, write it down, and that can be very helpful. If you're really organised and you feel like going onto the internet, the Beyond Blue website has some excellent resources and even some questionnaires. And you could take the time to fill one of those out, print it up, and bring it to your doctor and say, look, I've done this depression questionnaire on the Beyond Blue website and it looks like I'm scoring pretty high, so I wanted to talk about it with you. And that can be quite a good prompt as well. So a final thing to say about GPs, which I think is very important, is we are the gatekeepers of the mental health system. What do I mean by gatekeepers? There's a whole lot of mental health specialists out there. Psychologists who've done a lot of training in counselling, psychiatrists who are actually doctors who've also done a mental health specialty, and your GP will know who all the local people are in your area. In recent years, the Commonwealth government has set up a new program, what are called the Better Access and the Better Outcomes in Mental Health programs. There's some very good information about these on the Beyond Blue website, but fundamentally what they involve is making specialists more accessible and affordable for the general public. So the process is you can go to your doctor and they can undertake what's called a mental health plan, which is really a structured way of them finding out what's been going on for you, and arrange a referral to one of these specialists, particularly psychologists, who are partially funded then through our Medicare system. So it makes it a lot more affordable. And that's a very good option for people to be aware of. A difficult situation for many people in the community is that they are worried about a friend or a partner who has a mental health problem. And they'd like them to get help, they think they need help, but they're not really sure how to start. Sometimes they raise it with the person who either takes offence or isn't willing to get help or might not even think there's a problem. So this is quite a difficult situation that we see very often in general practice. I think a good start point would be that the concerned relative goes to the doctor and talks it through. This can be very helpful from a number of perspectives. Firstly, it's often a big load off their shoulders, and we know that carers and relatives actually carry a lot of the weight, and they're just happy to bounce it off someone objective and to hear, to have a hearing about what's bothering them and what they're worried about. But as well as that, the GP can suggest resources. For example, even a simple one-page fact sheet, about a mental health problem might be a catalyst for a conversation with that person. So, for example, you might have someone who you're worried about that they've got depression. You could actually print up the sheet, talk about it with the patient and go, look, you've actually got a lot of these issues. What do you think we go and have a chat to the doctor? And hopefully you can actually encourage them to come in. I think also if the relative has already spoken to the doctor, they can sort of reassure the person. They can say, look, this person's really good. I've had a talk to them. I think they'll actually be good. Why don't you come in with me and we'll go to an appointment together. So I guess that's the upfront way of approaching this problem. I guess there is some role sometimes for being slightly less upfront and saying things like, maybe we better just go and get you a checkup. And I guess there's ethics issues around that, but in reality I think that happens sometimes. Just a caveat on this, if you're very worried about someone in the sense that you think they might be at risk to themselves or perhaps to others, then I think a more urgent approach is needed. So for example, if someone was acutely suicidal, it would be important to get urgent help. And there's a range of ways to do that. One of the ways is there are what are called CAT teams, which any member of the public can ring, usually through the local hospital, and they can arrange more urgent assessments to make sure that people are safe. The good news is that a lot of depression and anxiety problems get better with the proper treatments. And we know what works because there have been decades and thousands of research studies which show us which things work and which things actually don't make much difference. The short version on the sorts of things that work are, one, common sense lifestyle things that you can do. So increasing your regular exercise, laying off the alcohol and or coffee and or other drugs which generally don't help the situation. Making sure that you schedule time to do the things that you enjoy or that give you a sense of satisfaction. So really just common sense, trying to get your lifestyle in order to help you get better. And that's number one. Number two is what I call the psychological treatments. A trained psychologist can help work with a person to look at the way they're thinking about things, look at the way they're behaving, and help them shift the habits that they're getting into. There are many other evidence-based approaches as well, but I think the cognitive behavioural therapy approach is very useful. The important thing to think about when you're getting psychological care is this based on science? And I think it's a really good conversation to have with the person who's trying to help you. The third area is medications, and not everyone needs medications. Certainly the research tells us that for mild mental health problems, often it's the lifestyle changes and the psychological treatments on their own are enough to get people better. But for more severe cases, or in particular clinical presentations, medications definitely do have a role. And as a doctor, there are some patients who they can change their whole lifestyle, they can talk till they're blue in the face with the best psychologist in Australia, and ultimately there's a bit of chemistry going on and the medications help them get better. And I think it's very important to be aware of that side of things as well. I think it's important for people to feel hopeful if they're going through a depression problem or an anxiety problem themselves or someone in their family, that with the proper treatment, there's a good likelihood that they will get better. Getting help early is important. It's like anything, the more entrenched things are, often the harder it is to improve things. But our research studies do tell us that there's a lot of hope and that people do get better with the proper treatments. I think it's important also to be aware when you are better that some of the mental health problems, let's take for instance depression, can relapse. Someone who's had one episode is more likely to get a depressive episode at some time in the future. And this is where your local doctor can be very helpful because they get to know you and they can work with you to work out what are the common sort of symptoms that you get when the wheels are starting to fall off again. Is it that you stop sleeping? Is it that you're staying up all night on the computer? Is it that you stop going out? People will find their individual pattern of what are the early signals that a problem is getting stirred up again, that they might be having a relapse. And if they've got a good relationship with their local doctor, they can go in and go, hey, I think I'm about to get back into that zone again. Let's get onto it. Let's get things moving quickly, and that's very important.